Order. Today we're reviewing the nomination of Dr. Tom Price to be the Secretary of Health and Human Services. Dr. Price, we welcome you and congratulations on your nomination. Welcome to you and your wife, Betty, who is here today with you, and I enjoyed having the opportunity to visit with you in my office and to learn from you about your plans. Dr. Price will be introduced today in a few minutes by Johnny Isakson, a member of this committee and Dr. Price's home state senator. Before Senator Isakson introduces the nominee, Senator Murray and I will each make a few introductory remarks. After the nominee makes his statement, we'll have the usual round of questions. Now, let me say something about the round of questions. Last night, we had a hearing of 3.5 hours. I had tried, as chairman, to be fair by following the same precedent we had for President Obama's two education nominees by having one round of 5-minute questions followed by Senator Murray and me asking questions and wrapping up. I don't want to re-argue that because we spent a lot of that 3.5 hours arguing about the 3.5 hours. I've listened carefully to what my colleagues have said, and I looked back at the precedent for the Health and Human Service Secretary when that person came before our committee. Secretary Burwell had one round of questions. Sebelius, one round plus Coburn. Dr. Coburn asked a question. Daschle, one round plus 3 senators asked a question. Leavitt, 6 members asked questions in the second round. Thompson, 1 round, but it was a round of 7 minutes. Shalala, 6 members asked a second round. So what I've decided to do is, in an effort to try to treat President-elect Trump's nominee approximately the same as the way we've treated other nominees, is to have a single round of 7-minute questions today. That would be the precedent followed with Secretary Thompson, and that seems to me to give every member of the Senate more time to ask questions of the Secretary. This is a courtesy hearing. Dr. Price will be before the Finance Committee on next Tuesday. A number of the members of this committee are also members of the Finance Committee. We don't vote on his nomination. They vote on his nomination and will be the ones that report it to the floor if that's their decision. We have the hearing because we have some of the healthcare jurisdiction, some important parts of it, and we would like to talk to him about especially those issues. He has all of his paperwork in place before the Finance Committee, including the letter of agreement with the Office of Government Ethics, which is on the website and available to members of this committee as well as others. And so it's my hope would be that in our 7 minutes of questions that we'd have time to focus on the responsibilities of the Department of Health and Human Services rather than have a continuing discussion about the number of minutes. There'll be an opportunity following the hearing to ask written questions of Dr. Price as well. Dr. Price, if you're confirmed to lead the Department of Health and Human Services, you'll be running an organization that spends $1.1 trillion a year. It's always troubled me, actually, that you'll be in charge of spending more than the Congress actually appropriates every year. By that I mean the part of the budget that we appropriate and which is under pretty good control, which is the part that has national defense and national institutes of health and national parks and national laboratories. Over the last several years and for the next several years, that part is rising at about the rate of inflation. It's not adding to the budget. It's about 1/3 of the total amount of federal government spending. But it's a little less than the amount that's in your department every year, most of which is entitlement spending, mandatory spending, and which is going up at a rate like that while the rest of the budget is going like this. You'll be overseeing Medicare and Medicaid, mental and substance abuse programs. We just enacted in December of last year, and the President signed, the most important reforms of those programs in a decade. Senator Cassidy and Senator Murphy were the leaders on that in this committee, along with Senator Murray. The Food and Drug Administration, we made important changes in the Food and Drug Administration, giving them new authority and new responsibility. For example, new authority to hire and pay the experts they need to move products and devices through the FDA at a more rapid rate, saving time and money and getting those devices into the medicine cabinets and the doctor's offices. That was Dr. Califf's #1 priority. We passed that into law in December. And then the implementation of Obamacare and the various proposals to repair the damage done by Obamacare and replace it with concrete, practical alternatives for the American people that give them more choices of lower cost health insurance. Dr. Price, I believe you're an excellent nominee for this job. You were a practicing orthopedic surgeon for nearly 2 decades. You were a professor at Emory University School of Medicine. I read about the resident doctors in training who you taught. You served as medical director of the orthopedic clinic at Grady Memorial Hospital. In the House, you were chairman of the Budget Committee, and you've been a leader in deliberations over the future of our health care system. So you know the subject very, very well. One of the first responsibilities that you will have is to give us your advice about how to repair the damage that the Affordable Care Act has caused to so many Americans, and how to replace it, or to replace parts of it, with concrete, practical alternatives that give Americans more choices of lower cost insurance. Let me give my view about how we might proceed on that, and then during the question and answer session, I will ask you more about your view. Following the presidential election, President-elect Trump said on 60 Minutes that replacement and repeal of Obamacare would be done simultaneously, his word. To me, that means at the same time. And then recently, Speaker of the House Paul Ryan said that repeal and replacement of Obamacare would be done concurrently. And then Senator McConnell said last week that we need to do this promptly, but in, quote, manageable pieces. Trying to interpret what those words mean, to me that means Obamacare should be finally repealed only when there are concrete, practical reforms in place that give Americans access to truly affordable health care. The American people deserve health care reform that's done in the right way, for the right reasons, in the right amount of time. It's not about developing a quick fix. It's about working toward long-term solutions that work for everyone. One way to think about what simultaneously and concurrently mean is to think about Obamacare in the same way you'd think about a collapsing bridge in your hometown, because that's just what's happening with Obamacare in my home state and in many other states. According to the Tennessee Insurance Commissioner, the Obamacare insurance market in our state is, quote, very near collapse. And across the country, premiums and copays are up. Employers have cut jobs in order to be able to afford the mandates of Obamacare. Medicaid mandates are consuming state budgets. In 1/3 of America's counties, citizens with federal subsidies have only a single choice of company to buy insurance from on the Obamacare exchanges. Without quick action next year, there may be zero choices on those exchanges. Their subsidies may be worth as much as a bus ticket in a town where no buses run. If your local bridge in Georgia or in Tennessee were very near collapse, the first thing you'd do, I would think, is to send in a rescue crew to repair the bridge temporarily so no one else is hurt. Then you would build a better bridge, or more accurately, in the case of health care, many bridges to replace the old bridge. And finally, when the new bridges are finished, you would close the old bridge. That's how I suggest we proceed. Rescue those trapped in a collapsing system. Replace that system with functional markets, as states develop their own plans for providing access to truly affordable health care, and then repeal Obamacare for good. First, we should offer a rescue plan so the 11 million Americans who buy individual insurance now in the exchange can continue to do so while we build a better set of concrete, practical alternatives. Second, we should build better systems, providing Americans with more choices of insurance that cost less. Note that I say systems, not one system. If anyone is expecting Senator McConnell to roll a wheelbarrow onto the Senate floor with a 4,000-page comprehensive Republican health care plan, they're going to be waiting a long time because we don't believe in that. We don't want to replace a failed Washington, D.C. healthcare system with another failed Washington, D.C. healthcare system. So we'll build better systems, providing America with more choices of insurances and that cost less, and we'll do this by moving more healthcare decisions out of Washington, D.C. and into the hands of states and patients, and by reducing harmful taxes. And we'll do this carefully, step by step, so that it's effective. Finally, we should then repeal what remains of the law that did the damage and created all this risk. I know that the President-elect has said that after you are confirmed, which is, I hope, is fairly early in February, that he will propose a plan to Congress. I look forward to that plan, and I know you can't tell us what that plan is today, but I do look forward to hearing from you how you suggest we approach this. We want to do this right. We want to sequence the events carefully and adequately so that Americans have concrete, practical alternatives in place of what is there today. And we want to make sure that the parts of Obamacare that are repealed are replaced before the repeal becomes effective. Senator Murray.